So I'm a bit of an outsider here. I'm not a medic, I'm not a sports medic, I'm not a physio or anything. My PhD was in physical activity, but in the policy and politics of physical activity promotion. So some of you might have to kind of step out of your professional or sport and exercise medicine roles for the next 3 minutes and think more as voters, as citizens, as people interested in policy, and think about this whole challenge of getting the nation moving. But I want to reflect on this issue of why we don't seem to be able to tackle physical inactivity, and of course reflect on our role as professionals, whatever your specific discipline in sport and exercise medicine is, our role to get on with this topic. I'm going to sort of attempt to get you thinking a little bit. I kind of figured this would be a sleepy session, the last thing on a Friday, and question some of our attitudes towards this topic. I might not go as far as Tanni Gray-Thompson. Did you hear that she said at the UK Active, sport is dead, she announced that last week. And what she meant by that is we must focus on physical activity. Let's not compartmentalise things into sport or exercise or sports medicine. Let's think about the role of movement, activity in people's lives. She would say that she's the new chair of UK Active, but UK Active is now, taking on this role very thoroughly. But what I'm going to do then is give you a glimpse, I guess, into my world, which is public health. This is where public health came from. This is the definition, the science and art of promoting. That's what I like about public health. We've got lots of science, not as much as the last two speakers. I won't have much data here today, lots of opinions, no data. But it's the science and art, and to some extent, a lot of what public health people do, whether it's preventing smoking or addressing child diabetes or physical activity, is sometimes a judgment, and it's sometimes politics as much as it is science. Public health came from prevention of communicable diseases, it came from infection control, and it came from sanitation in crowded cities. And really, it's moved on so that the environmental risks are still there, but are quite different. And here shows the environmental risks of excess traffic, whether that's in terms of increasing pollution, increasing risk on the road, or decreasing the possibility that people can be physically active in their daily lives, and that for me is one of the key issues. So a glimpse into public health and what we sort of obsess about and the sorts of things we get interested in. So this is a word cloud. Do you know what these things are? So this is a copy-paste of all the contents of a conference put into a word cloud, and the more times the word appears, the bigger the word on the slide. Okay, so this is one conference. Have a quick sort of glimpse through that and think, well, what sort of conference was that then? Would you like to go to that sort of conference where these things are being discussed? You can see activity, exercise, physical interventions, and all that stuff. Okay, that's a conference. Next one. This is another conference. Same thing. All the words from the conference put into a word cloud. Who'd like to go to the first one? Hands up, please. Who's interested in this? Who's interested in these sorts of issues? Most of you, okay. Who'd like to go to the second one here? Doesn't it look dull, this one? Well, you're in it now. This is, you probably guessed the joke here, you're in it now. So my world is more concerned with, so this is from the BHF, the British Heart Foundation National Centre for Physical Activity Promotion Annual Conference, which is concerned with, population approaches to getting people moving. How can we move whole populations? How can we identify target audiences within those populations at greatest need, greatest health risk? How can we use behavioural science, environmental modification to get people physically active and moving? And what I noticed in this conference is there isn't much of this stuff going on here, is what I've seen. There seems to be a key focus on injury prevention, a key focus on working with sports people, elite sports people, and not so much about, well, what about all the rest? What about the 90, 95, 98% perhaps of the rest of the population who aren't moving enough? So that's what I'm interested in. So these are the sort of figures that we bandy around. This is from a Public Health England infographic that talks about the number of people, 33% of men not active enough for good health, 45% of women. About the trends we've seen over time, 64% of trips now made by car, walking trips decreasing. So it's taking an overview of who's being active and who isn't, and how the environment has shaped this. And what Public Health England does very much now is put inactivity at the centre. So previously, over the last 10, 15 years or whatever, we've been focused on how many people are active enough, reaching some sort of threshold, 150 minutes a week, things that the new sort of flavour them up. But Public Health England is saying, well, actually, the greatest public health benefit by far is in getting the sedentary, people who are doing little or nothing, moving a little bit. And so they put inactive people very much at the centre of any sort of policy focus. So these are the sorts of figures we obsess about. This is from a slide set just launched last week, publicly available if you want to use these. And this is the proportion of children who spend 6 or more hours sedentary per day. Just think about that, 6 or more. So this isn't sleeping, this is other sedentary behaviour. And you can see that by age of 13 and 15, proportions are really getting pretty high in the week, and even higher at the weekends. You think in halcyon days gone by, children would be running free in the woods and climbing trees and running around at weekends. No, weekends are worse because they're not walking to school, they're not cycling to school, they're not being made to do PE. We look at data like this, trends in physical activity. You can see this is children aged 2 to 15 years decline in the amount who meet the recommendations between 2008 and 2012 among boys and girls. And of course we look at the trends in prevalence of healthy weight. So this is Health Survey for England, and it shows actually a bit of a levelling off, not such a horrific increase as we have seen recently, over these years in childhood obesity, and perhaps a levelling off in recent years, which for once in public health terms is some good news. The scandal really with childhood obesity are the stark inequalities, social class and deprivation inequalities in obesity prevalence. So here, the least deprived groups are far, among Year 6 and reception children, are far, far less likely to be obese compared to the most deprived. And you sort of, doesn't that make you think straight away, why is that? Why would that be the case? What have we done to create a society that's so unequal that people are much, poorer children are much more likely to be obese? And then again, if we're looking at shockers, I'm sure you've all seen this before, that the year-on-year increasing, consistent, steady rise in obesity among adults, both men and women, and actually now women catching up men. Who knows, it's maybe the start of a decline, but I doubt it. So these are the sorts of data that we concern ourselves with, and obviously attempt to think, well, on a sort of national or population basis, why is this happening? This is a nice little infographic from Move Eat Treat, who I think share many of the objectives of this audience here, that look at this sort of evolutionary aspect. The basic point being that we weren't made to sit in chairs the whole day. We weren't made to drive ourselves around to get places. We were made designed and created as hunter-gatherers, roaming the plain and killing bison or whatever we killed. But our bodies need to be physically active in order to be healthy. So, and Gareth referred to this infographic that shows, that tries to sum up, and I think it's one of the receipts, tries to sum up the current recommendations from the Chief Medical Officer for, so this isn't clearly focused on elite athletes or sports people or the sorts of people who you may be mainly concerned with in your day-to-day lives, but is concerned with the average general public, the amount that people should be doing to reduce the rates of diabetes, as we heard just now, cardiovascular disease and so on. And I think we know quite a lot about this now. The evidence is pretty strong for the type of physical activity that people should be doing to benefit their health. We've got pretty good evidence for the specific health benefits. Lots of good research, as we've just heard, is ongoing to kind of refine that. But I'd argue we don't really need to focus too much on that anymore. We need to focus on what we actually do about it. So I think what we probably need is a new strategy for sport. Isn't that what we need? If only we had a new a government department taking a fresh look at this whole issue, we could change the face of sport across the UK. Well, you can probably tell from the tone of my voice that they're fed up with this sort of response all the time. A new government comes in, we need a new sports strategy, we need a new physical activity strategy, we need a new obesity strategy. The old one was rubbish because the last government didn't know what they were doing. This time will be different. And so I looked at this one with some trepidation. And just recently, consultation in August this year. I think the consultation's closed if you were keen to respond. So I had a quick look, and this caught my eyes. There's no doubt that the London 2012 Games inspired many people to do amazing things. Well, it inspired me to watch the cycling. I really, really enjoyed that in the triathlon, that's for sure. It inspired me to get another beer out of the fridge, as Johnny Brown won and so on. Our elite athletes are fantastic role models. And hang on, we're starting some past tense here. This is it. We had hoped the inspiration would touch everyone. You know, the Olympic legacy in terms of participation simply didn't work. There's very, very little evidence that there was a trickle-down effect or a festival effect or any of those types of things. Legacy for other aspects of the games we know was quite good in terms of housing and jobs and so on. But for this role model idea, it simply hasn't worked. And as the Minister went on to say, the fact that participation rates are now beginning to decline from their peak in 2012 shows that we need to do more. You know, I couldn't agree more. We kind of shifted, well, when I worked in, I first worked in this area in 1992 when I worked on the Allied Dunbar National Fitness Area, working for the Health Education Authority, which is like the national public health body. And we were told then, everything's changing. We're going to work with the sports council, as they were called then. Sport and health are going to come together, and we're going to create a national active society. And I was part of that. I really bought up into that message. And we tried, and then we moved apart again, and we came together again, and we moved apart again. And in this particular period, in the run-up to the Olympics, the focus was entirely on elite sport. And you know, now we've seen that didn't really work, and so we're coming back together again. We all have to hold hands and make good friends. And so this minister says that's why we need a new sports strategy, and that's when my heart just sinks again. You know, do we really need to put all our emphasis into a strategy that focuses on competitive sport as a means to getting people healthy and physically active? Well, I really don't think so. I had a quick look at policies and strategies, and I thought, well, if policies and strategies are that good, then maybe countries with more of them would do better in terms of physical activity. So this was a slightly cynical attempt at fudging some data. So I used the WHO European database. There's it's called the NOPAT, Nutrition, Physical Activity, Nutrition, Obesity and Physical Activity database. And that lists all the policies in every EU member state on physical activity and nutrition. And so those are the red bars. And the Eurobarometer study shows all the same countries, EU member states, the proportion of people who exercise or play sport regularly. And I don't know about you, I'm not really a statistician, but can you see a correlation in there? I can't really, can you? What you see is the UK as the world leader, or at least the European leader, in producing 64-page documents with multiple colour photographs and massive references, signed by the minister at the front, and launched in a blaze of glory, signifying nothing. And what you don't see is a strong correlation with the actual physical activity levels. Places like Ireland, just get on with it and don't produce a great number of policies and seem to have high levels of activity, and it's all over the place. Sweden is a slang out loud. I just get a little bit tired of governmental attempts to continue to put all these issues together into a new strategy document and keep on going. This was just to say that if you believe that data, if you believe that the UK is this high in terms of physical activity, maybe think again. In the Lancet, when they use the same data source to compare WHO member states for physical inactivity, the UK was pretty much a world leader, so we have something to worry about. So, hands up if you've seen this thing or heard of this thing. A few, that's good, okay, a few hands. This is the exercise for health sessions. I'd expect more than earlier sessions. I think this is all we need. I don't think we need more sports strategies. I don't think we need each government department to relaunch a new, Department for Transport to launch a walking and cycling strategy, and Department for Health to launch a physical activity strategy, which is what happens. I think, and I declare an interest, I worked a bit on this with Public Health England, but I think this thing gives us, as professionals from all sorts of different disciplines working to promote activity, the framework we need. Instead of being a strategy with big political statements, because Public Health England is kind of at arm's length from government, it's able to be a bit apolitical and provide this idea of an evidence-based approach to physical activity. And it provides a framework. It's like an action plan almost. And what PHE consistently say is that they can't do much on their own. It's about working in partnership with people across the country, from sport and exercise medicine, from physiotherapy, from public health, from health promotion, from transport, from the environment, sports and so on. And this is how PHE sort of cuts its cake or sets out its plan. And I think it's this moving professionals bit that's particularly important when people in sport and exercise medicine are concerned. Because what the evidence says really is that it's this idea of a systems approach. the evidence says that it's clearly not about, that there's not one single sector or one single approach that will make a difference, that it's about multiple levels of influence. And I've always liked this model from Duggar and Whitehead, that it's used usually to describe the influences on a person's health. So a person has a number of things that they can't change about the influence their health. But beyond that are things that we choose to do, whether we choose to smoke or drink and so on, or whether we exercise in our lifestyle. And beyond that are things that influence us in our society and in our local communities. And beyond that, the work environment and our level of education. And beyond that, the physical, social, and socioeconomic conditions. So you can imagine, even if someone was highly motivated and lived in a supportive community, if they were living in an extremely poor environment and didn't have the money or facilities or time to be physically active, because they needed their time to just to live, just to scrape a living, then you can see how that's an important influence. But I also like the way this kind of helps us think about interventions or think about things to do about it, and it might get you thinking about what role you could play. We're going to start from the outside really quickly and move in with the environment. This is my sort of favourite area of working, because I think this is one of the, I guess this is one of the most important influences on physical activity. And I say I guess because, unfortunately, because of sort of research design issues, we have the least strong evidence about this issue. You can't really randomise communities into building walkable and bikeable places. But in short, I think if you'd set out to design a sedentary or obesogenic environment over 20 to 30 years, I think looking outside, that's what you've got. I think we would have tried to increase traffic, we would have tried to restrict walking and cycling, we would have tried to close down play spaces and so on. I think the environment has been created that does not support physically active movement, and so efforts to try to sort of reclaim that and create healthy active places, I think, are extremely important. So we can think about how maybe not directly in your professional roles, but how we can support in our own communities and neighbourhoods efforts to reclaim parks, efforts to close down some roads perhaps after school, as some community groups are doing, to allow children to play, efforts to improve the environment for cycling. At community level, we know that there are a number of things that the people in their own communities can do to reclaim the environment and to take community level action to improve conditions for physical activity. So this is an evaluation of a Fitter for Walking project where people in their local communities identified things that were barriers to walking and cycling, locally for them. So this might be dog mess in the underpass, this might be poor lighting, this might be a particular road crossing that wasn't in place. Low-cost actions that were put in place made a big difference to people's local level walking. And we know that referring people to group opportunities for exercise and physical activity, such as walking, not only walking, but such as walking, are extremely effective. And the Ramblers started the Walk for Health programme, now led by Macmillan and the Ramblers together, highly successful in getting people moving from sedentary behaviour on things like leg walks, and now being extended to people living with cancer. But I'm guessing that most of the audience are kind of in the middle of that diagram, in your professional lives, working on a one-to-one or group basis, and influencing people, the way that people think about physical activity. And I think this is extremely important. We might not have, as in face-to-face consultations, we might not have the reach into big numbers of people, but if enough of us do it, if enough people keep on going, if enough contacts are made, it can make a difference. So I do like this idea of making every contact count. I went to a great presentation just now that exercise works, and the way they're really trying to increase education and training for health professionals and physical activity promotion. And the idea of making every contact count is that basically every contact that a health professional has with an individual, they mention an aspect of physical activity. But we know there's good evidence for counselling and brief advice, and we know that it doesn't really have to be a health professional or a GP telling people to exercise. Most people know physical activity is good for them. Most people, if they are encouraged to talk about it in a supportive, motivational, interviewing type way, can identify their own opportunities for physical activity. They know their own solutions. You can just say, have you thought about, well, tell me the reasons why you might not have walked here today, and tell me what is that type of approach can be effective because people know their own answers. We know that things like pedometers can work, particularly if they are used with support. So if not just handing someone a pedometer and say go walk more, but actually getting people to record the number of steps they do, use that to give themselves feedback and have feedback with a professional. And we know that things like personalised travel plans can work. You know, even in Australia in particular, the public transport sector was involved in helping people to sit down and think through how could they travel differently, how could they get out of the car more. And we know that screening and follow-up can be an extremely important way to get to people. You know, we've got some barriers and we've got some problems, and I've heard a bit today about the challenges that all sorts of professions face in terms of not receiving training about physical activity. I know a number of people, including Exercise Works, including PhD in the Clinical Champions Programme, and some of the stuff on Motivate to Move, are trying to tackle that. Sometimes I sort of wonder, well, how much specific technical expertise do we need on this issue? It's mostly about interpersonal skills, it's mostly about communication, and it's mostly about the way we talk to people. So I think our challenges, this is the last slide, are, first of all, correctly finding and identifying inactive people. I think if we're serious about rising to this challenge, then we have to focus on finding inactive populations. Now, whether that is individuals with whom you consult on a day-to-day basis, and you thinking, they're actually not doing much exercise, how can we talk about this? Or whether it's finding and targeting specific inactive communities. And it's not that easy. So I'm working with Sport England on evaluating their Get Healthy, Get Active programme, which is specifically designed at finding and working with inactive communities and getting them to do one session of sport per week. And we've got a screening question that identifies inactive, and it only finds it's only about 50% of the time. People tend to overclaim. So it's sometimes difficult. It's about understanding inactive people. You know, and that's difficult, isn't it? If you work with sports people and if you work with elite performers all the time, I would imagine that it's difficult to understand the motivations or lack of motivations of someone who just can't be bothered to be physically active, of someone who thinks it's entirely appropriate to drive everywhere, of someone who never thinks of any other mode of transport apart from the car. Basically, someone who thinks, well, I feel all right in my life without doing any exercise whatsoever, so why bother? And I think, and I'm not claiming to understand people who think like that, because I'm pretty active myself, but that's a real challenge, I think, is to get inside people's heads like that. I think the message is to get people started on anything. We don't need to specify. People say, oh, what's the best exercise? There's no best exercise. The best exercise is the exercise you do every day. Someone will keep doing for the rest of their lives. And if people choose a particular activity, let them choose it. That said, we can also play a role in recommending appropriate activities, in particular things that at least aren't unsafe. And I was talking to Joe from Move Eat Treat, and he said one of the key things they do in their organisation is focus on enjoyment, not outcomes. People aren't really interested in addressing their blood lipids or reducing their cholesterol or their resting heart rate or whatever. They want to have fun. They want to enjoy being in the outdoors. They want to enjoy running, walking, swimming, whatever it might be. I think there's lots we can do to help to connect people. So I'm thinking about connecting groups of inactive people with each other to support each other in being physically active, and that's clearly what the walking groups have done. And I think that the overall message is that for the whole population, most of whom would benefit from more physical activity, activities for life is something that people need to do for the rest of their life. So I'd leave those with you as a thought, and I would say to you, in your professional lives, you may focus mainly on sports people, you may focus mainly on injury prevention and so on, but my challenge would be, what can you do for the physically inactive populations? How can you adjust your practice and how can you work differently to do that? Just to finish, to prove that I don't hate sport altogether, this is me on the finish line of a triathlon recently. Glad to finish. Thank you.